Welcome to 3 Talk. Everyone loses at least 100 hairs a day, but when these hairs are not replaced, thinning and even baldness can occur. This can lead to psychological problems for both men and women. Hair loss and baldness is what we'll be discussing this evening. Doctors are in studio to take your calls on 086 2233 303. Welcome Dr. Kevin Alexander, MD of Dr. Alexander's Hair Loss Clinic, dermatologist Dr. Pulile. Let's just look at kind of the psychological problems that one suffers, because we all want to have hair, and once that hair, Kevin, starts disappearing and starts thinning, we go through all sorts of problems. Let's just talk about those. Well,
Nolene, the hair is probably the most visible part of the body. And when you start to lose your hair, it changes your appearance. It can even age you for up to 20 years.
Yeah.
And of course, this impacts negatively on your self-confidence, on your self-esteem, which has a knock-on effect when it comes to success, both socially and on the work front.
Right. And your take on, just the psychological impact of hair loss, Prof?
Well, in fact, the latest medical treatments have proven that not in everybody, but certainly in a very high percentage of men and women, that we can now achieve not only stopping the balding process, but reversing it. So there is something that people can do these days. They don't have to accept.
15, Anonymous has been having hair loss problems. Her hair is really, really thin, and she's now 25. So 10 years of continuous hair loss. What is it that she can do?
In fact, it's usually genetic, the problem. So taking vitamins is very unlikely to help. And the general public is very much unaware of the fact that the latest medical treatments can achieve high success in a big percentage of men and women. And I'll show you later on, when we show you some of the photographs, just what we can achieve these days with medical treatment. As we mentioned, the most common one is the genetic one. In fact, 95% of the patients that I see at my clinic in Bedfordview have got the inherited condition of what we call alopecia androgenetica, or male or female pattern baldness. Then your other less common conditions include one called alopecia areata. We'll see photographs of that just now. There's fungal infections of the scalp, there's thyroid gland problems, and there's a host of less common conditions as well.
Pulile?
The answer is people respond differently to medical treatment. We have a high success. Try medical treatment for at least 6 months and see what response you get. And we certainly have achieved regrowth in the front, so it's very possible that we could help Gavin, but I can't make any promises.
All right, so there are no guarantees.
When it comes to side effects on a drug like Propecia, it's only 1.8% of men who will suffer loss of libido. And for most patients, when I show you the results, you'll see what I mean, because it doesn't take that long. The earliest time we see a photographic change is usually 3 months, the longest is 6 months. And for most patients, if it means...
Okay, if I may, Kevin, we've got a picture, well, 2, 4, 6 pictures on the screen right now. Have you used medication on that patient?
That is correct. This is a patient with male pattern baldness. The first 4 photographs on the left cover 10 months. He started treatment in January of 2001. And by November of 2001, he's grown his hair back. The 5th photograph is taken 3 years later, and the last photograph on the right is taken 5 years later. He's colouring his hair because he was going grey. He's still a patient of mine. He's almost 9 years on treatment, and he's still got a full head of hair. And for him to pay a certain amount every month to keep his hair, having grown it back, is a small price.
He does have to be on the medication for the rest of his life.
This is not a cure, it's a control. I stress this to my patients. There is no cure for any genetically inherited condition, simply because you're dealing with genetic receptors, you're dealing with hormones, and we are driving a barrier between the two. It's the same as when you treat blood pressure or cholesterol. You cannot get a cure, you can get control, and this is very effective control.
All right, let's see another picture. What are we seeing
there? This is also a male patient, aged 37. The photographs are taken 10 months apart. He grew his hair back on medical treatment.
Using the very same medication that Pulile and Prof were talking about. And at no stage did that patient suffer from erectile dysfunction or none of that?
No.
And from your patients, Pulile, who have had the medication that you use, were there really bad side effects for your patients?
The patients that come to us in 9 months are not as clear as this.
Well, there's lots of temporary causes of hair loss, for instance, following illnesses, operations, accidents, emotional traumas. And as long as the hair that grows back is as thick and as strong as the hair that fell out, you won't have a problem. It's when it grows back thinner and finer that it becomes a problem. So we need to establish that as well.
Okay. All right. Let's just hear Kevin first, and then we'll come about what we can do about it.
It's a devastating condition, especially when it affects young people, because Your body makes antibodies against your own hair follicles, and you literally reject your own hair. And overnight, you develop complete bald patches, and eventually you can take your eyebrows, all your body hair, and it's a difficult one to treat. We do treat it at our clinic. We will show you some photographs in a moment, so it is possible to treat it. But I agree with Prof, we have to make a diagnosis.
A diagnosis is important. We'll have more after this. Kevin, you disagree?
I disagree because I think one should always try. There's always a possibility. I mean, we've taken patients completely bald for many years, and they've grown their hair back. And half of them have been able to keep it for a good while, and some of them for many, many years. So one can never just say to a patient, give up on it and just don't bother to treat it. I disagree with that.